Good afternoon. It's really lovely to welcome people. My name's Dr. Mary Docherty, and I am a liaison psychiatrist. I'm also the Chief Medical Officer at SLAM and Clinical and Strategic Director of the College Centre for Quality Improvement. And I'm really just so delighted to welcome those of you that have joined us this lunchtime. And this is the first in a four-part series of webinars to support people in their implementation of a brand new report, which is what we're going to be talking to you about today and what we're extremely excited about. And this report is Delivering Greener, More Sustainable and Net Zero Mental Health Care, Guidance and Recommendations. And this report was commissioned by Greener NHS, and it's been developed by the National Collaborating Centre for Mental Health alongside the Royal College of Psychiatrists Centre for Quality Improvement. And it's a really, really incredible piece of work that's been shaped by a multidisciplinary expert reference group, comprehensive literature review of all of the UK green plans. And what it does is it provides us with what we think is the most evidence-based guidance and recommendations on delivering greener, more sustainable and net zero mental health care that there currently is, certainly in the UK and possibly even in the world. So if you've joined this webinar, it's likely that you might be a part of the mental health community. So why should you, as a member of our sort of wider mental health community, be interested in the report? Well, quite straightforwardly, that's because we're facing a climate and ecological emergency. The disruption to life that is posed by climate and ecological degradation is a crisis, and it presents an unprecedented threat to human health. Because climate change, pollution and biodiversity loss have created a health crisis, and it's imperative that the mental health community is informed about this, but also actively engaged in these issues. And it's also essential because our actions, whether we are service users of services, whether we are providers of services, whether we are commissioners of services, our actions now will have an impact not only on kind of our immediate future, but generations to come. And our actions and how we approach the delivery of mental health care wherever we work will have implications, because climate change has got significant implications for mental health. It disproportionately affects vulnerable groups, including people with pre-existing mental illnesses and children. Now, the mental health impact of climate change is considerable, and there are quite complex interdependencies that link climate hazards and threats through exposure pathways, environmental, socioeconomic and psychosocial, that interact with vulnerability factors and inequalities to contribute to poor mental health outcomes, whether they be development of mental health conditions such as anxiety and depression or PTSD or substance misuse, but also they're associated with significant negative psychosocial outcomes. So combined, because of the mechanisms by which we know that climate change interacts with and contributes to mental health need, this also means that there's a potential impact on the increased need for mental health care, which drives this unsustainable cycle and prevents greater threat to our planet. And what this shows is that there is a real need at this time for mental health services to adjust and adapt. So that's why climate change matters so much within mental health, and we're going to hear a little bit more now and over the course of the webinar series. But really it means that our choice to sit back and just do nothing has passed. That isn't really an option any longer. So we're just so delighted that whatever stage you are at with learning about sustainability, starting to think about it, starting to think about how you embed some principles into your practice, whether you're an expert, whether you're an activist, whether you're a beginner, or whether you're just a curious backbencher putting your foot into the water around this. We're just so pleased you've joined us today. So I'm excited now to introduce our speakers, because in this session we're going to be joined by Dr. Clare Taylor from the National Collaborating Centre for Mental Health, but also by Siân Hodgkinson, who's People Participation Lead for Environmental Sustainability at East London Foundation Trust, and also Matthew Riley, Patient and Carer Representative at Bradford District Care Trust. Claire's going to start, and she's got the unenviable task of condensing a year's worth of work and passion and sharing this to make it accessible and explain to you how this commission was carried out and what recommendations have been made. And Siân and Matthew, who are also patient representatives with the college and have been critical to the development of this report, they're going to discuss but also inspire you on how to empower and engage people in a meaningful way to tackle carbon reduction together. So one final bit of housekeeping before we pass over to our speakers. Please do post questions. You're going to get lots of information today, but we do want to make sure we've got some time for questions at the end. The webinar will be recorded, so I hope people are comfortable with that, and we'll circulate the link afterwards. And remember, this is the first of 3 or 4 in total of webinars that are here to support you in your services wherever you work, to implement the recommendations that you'll hear about today. And then finally, there will be a link in the chat that will encourage you to register for the Knowledge Hub. The Knowledge Hub is where we're building an online community for backbenchers, beginners, experts, and activists to start to apply and implement some of the recommendations in this report. You'll find access to evidence, contact with other people, resources, events, and so on to help you implement a net zero approach within your organisation. So I think with no further ado, Claire, I'm absolutely delighted to welcome you and thank you for all the work that you and your team have done on this. And you're going to talk us through now the major findings of the report. So thank you, Claire.
Thanks so much, Mary. And hello, everybody. My name's Clare Taylor, and I'm Head of Quality and Research Development at the National Collaborating Centre for Mental Health. That's NCCMH. Next slide. Thanks. And if you just, yeah, thanks. So I'm just going to take you through how we developed the report and some of the highlights from the report, including the recommendations. So for those who don't know, we were commissioned by Green at NHS to produce guidance and educational materials, of which this webinar is one of those materials, to support the delivery of greener, more sustainable and net zero mental health care. Just scroll through, thanks. So our first task really, it was a fantastic task to convene an expert reference group. This included probably about 25 people in all, clinicians and professionals, but also people with lived experience. So Sean and Matthew, you'll be hearing from them later. And the ERG met, I think, 5 times in total over the course of the development of the guidance, so advising on all things from the methods that we use through to the interpretation of the evidence and the generation of the recommendations. I think there's one more on this. Thanks. And yeah, I'm going to take you through the recommendations a bit later. So just as a background to the research that we conducted. So there were 4 main areas that underpinned the research. So the first was the literature review. And we asked quite a broad question, actually, what interventions, approaches and initiatives can be used to work towards achieving net zero mental health services in the UK. And it was quite, I mean, I think we got a total of, there were hundreds of hits for that search, for that question. And it was a pretty rigorous literature review. So yeah, that kind of bolstered the rest of the research. So the call for evidence was a national call across NHS trusts, and we asked for examples of interventions or approaches that showed what worked in terms of delivering greener, more sustainable and net zero mental health care. We also reviewed all of the green plans from mental health trusts in England, and because of the breadth of information in those plans, we really just honed in on those sort of new and interesting ideas that were established and undertaken by the trusts. And then finally, we were asked by Green at NHS to map the carbon impact of the mental health care pathway, and I'll go through how we did that in a little bit. Next slide, thanks. So we structured the research findings according to the 4 principles of low carbon care developed by Green at NHS. So if you don't know those, I'll just quickly go through them. So that's keeping people healthy, right care, right place, right time, low carbon treatment and care settings, and clinical leadership systems and workforce. as I said, we organised all of the findings according to those. There was some overlap. You'll see there's quite a lot of overlap. So just going through keeping people healthy. So this just is a summary of what we found. It's a very, very high level summary. There's much more detail in the evidence review. So just quickly running through these. So some things that you'd expect to see here, I'm sure. So access to green spaces, to promote mental and physical well-being, implementing sustainable models of care, including those that reduce preventable hospital admissions, which are, hospital admissions are very carbon impactful. Keeping people healthy by responding to health needs that occur as a result of climate change. There's a little note that explains what we mean by that, but also what was in scope for this project, because wider prevention unfortunately wasn't. There just wasn't scope to do that in the time that we had available. Also food and nutrition, such as vegetarian and vegan menus in hospitals. Next slide, please. Right care, right place, right time. If you just could scroll through, thank you. So we found measures to improve the efficiency of care delivery here, delivering treatment in alternative formats. So things like remote care, video and telehealth. Obviously something you'd expect to see, green treatment alternatives such as nature-based interventions, walking groups, mindfulness outside, and therapeutic communities. Just on the walking groups, I think one of our favourite ones was walking with llamas. Or was it alpacas? Yeah, that was a really nice example. And then finally, alternative patient transport and transfer services, such as using low carbon vehicles. Oh, one more. And preventing, a really important one actually, preventing unnecessary use of the care pathway. So on low carbon treatment and care settings, this is just again a summary of the findings. So using sustainable procurement practices and supply chains, reducing energy consumption, promoting sustainable staff and patient travel. Again, there's a bit of overlap here with the previous principle, obviously waste reduction and using lower carbon interventions. Next slide. Oh, that's always the last one. And improving medication and prescribing practices, which obviously includes deprescribing. And then finally, under clinical leadership systems and workforce, we have training and education, top-down leadership, empowering other healthcare professionals, including nurses. I think there's some particular evidence around nursing, which is why they're highlighted, to take on net zero leadership roles. Also having new and dedicated staff roles focused on meeting net zero targets, such as having a sustainability lead. And then measuring and reporting on carbon emissions, really important that. And methods to implement carbon reduction measures, such as what are called carbon exchange programs. Thanks. So I'm just going to talk you through the carbon mapping workshop now. So we convened a sort of extraordinary meeting for the expert reference group to go through what they considered to be sort of the most carbon intensive areas. So we split them into 3 groups, covering primary, secondary and tertiary care. And then we produced a kind of visualization of what those high carbon impact areas looked like, which I think is on the next slide. So this is quite, might be quite difficult for you to see, but it is in the guidance, and you can have a closer look at it there, but you'll see that there are overlapping areas here and overlap in the lozenge sort of areas. You've got medication, which obviously overlaps primary care and secondary care, and also secondary and tertiary. But you can see how it's not sort of clear cut, but certainly secondary care sort of is seen to have sort of the most activity that can be sort of carbon intensive. Okay, next slide, thank you. So just giving you a few, yeah, as I said, secondary care was considered the most carbon intensive. The ERG also highlighted sort of the bottleneck that can occur, that sort of going from inpatient care back into the community. Obviously the impact of acute inpatient care is also high. Obviously running hospital services, and the length of time that people often stay on inpatient wards. The ERG was also really keen to emphasise the importance of sort of preventative community support, and how often a lack of adequate support outside of hospital can indirectly influence the carbon footprint of acute care. And then in the box on the right, there are just a few factors there that, as I explained earlier on the graphic, there are sort of overlapping activities that really contribute to the carbon footprint, such as medication and prescribing, the energy in buildings, and patient and staff travel. Okay, next slide, thank you. So I'm just going to take you through some of the actions that we thought, and the ERG thought, were really important in underpinning the implementation of the recommendations. So there are 10 in total. I think they're on the next slide. So under keeping, again, it's under the principles, the greener NHS principles. We thought that addressing the social determinants of health was absolutely key here. So that's obviously focusing on illness prevention in the first place. And we highlighted certain determinants, including sort of poor housing, poverty, isolation, and unemployment. Making every contact count as well, to reduce the risk of mental health problems worsening or preventing problems from occurring in the first place, seen as absolutely crucial. I mean, they're all crucial. Also promoting and collaborating with community services that work to prevent or mitigate mental health problems, and then increasing awareness of mental health issues in communities, schools and workplaces. Okay, next slide, thank you. I think we've just got a couple under right care, right place, right time, but really important ones around empowering service users to take a greater role in planning their own care, because they know what's right for them, and it can mean that effective care can be engaged with earlier. Designing and developing care pathways that have consideration of the environmental impact, so that's sort of having care close to home, and having joined up working with partner agencies. And then under low carbon treatment and care settings, we've highlighted the importance of using sustainability and net zero practices when planning and delivering care. So that's in, right from sort of initial care planning meetings through to subsequent reviews, and then always delivering care using evidence-based treatments to optimise outcomes. Again, that goes back to the previous action. Next slide, thank you. And then finally, on clinical leadership systems and workforce, we have sort of embedding sustainability considerations in all procurement practices, and that would include sort of routinely undertaking supply chain mapping. Training is really important, obviously, ensuring that there's mandatory training on sustainability and net zero practices delivered across all mental health care professions, and fostering an open learning culture where ideas can be heard, implemented and supported. It's really important. Okay, I'm going to take you through the recommendations now. So next slide. So as I explained, we generated the recommendations from the research findings, but we also obviously discussed the research at every ERG meeting. And we generated a lot of recommendations, which we then we tested according to their sort of feasibility, and asked the ERG to rate them in terms of their importance and feasibility. And they were further prioritised by Greener NHS. So these, I think on the next slide, we've got the we've separated them into who would be responsible for implementing the recommendations, so policymakers, professional bodies, system and service leads, and then staff professionals working in mental health services. And each recommendation was considered by our equality advisory group. So they conducted an equality impact assessment on all of the recommendations, which are marked by a little scale symbol in the report. I think we're going into the overarching areas now. So yes, these the 10 kind of almost like sort of overarching priority areas. So I'm just going to quickly take you through these. So embrace the circular economy approaches to mental health care procurement and ensure alignment to the NHS supplier roadmap. Reduce the use of single-use medical and healthcare products and switch to reusable items. Improve energy efficiency of mental health estates and facilities, including recycling and waste management. And there are 2 on travel here. Enable the adoption of net zero, sustainable and efficient travel practices within mental health care, and reduce travel miles related to mental health care service delivery. And then on the next slide, we've got the final 5. So provide lower carbon food choices for patients and staff, improve efficiency and quality of patient care through sustainability, using QI methods such as SUS-QI. So the SUS stands for sustainability. Promote nature-based mental health care through increasing access to green spaces and social prescribing practices. Develop leadership and the workforce learning and development infrastructure to support the transition to net zero mental health care, and build a sustainable and responsible mental health workforce focused on looking towards the future. And then under each area, we have another sort of set of recommendations. So I'm not going to go through all of those now, but we've just got a few examples on the next couple of slides. So just giving you a few examples of what the recommendations look like, and who they're targeted at. And then there's an example of an equality impact consideration there. So we've got recommendations around using green procurement schemes and creating climate and sustainability networks and within organisations, and alternative transport incentives. If there's no equality impact consideration, it's kind of we've just indicated that in the report, but where there is one, it's detailed underneath each recommendation. Next slide, thank you. Just a few more examples here. So we've got one around prescribing, working closely with community services to embed social prescribing. And then the final one on this slide, building net zero sustainability principles into all staff roles. which I think that's the last slide of recommendations. Oh yeah, this is the just highlighting some gaps in the evidence where we wanted to make some research recommendations. So I mentioned earlier that prevention was out of scope for this piece of research, but we've added a research recommendation here so that we can, if we do further work in the future, which obviously we hope we will do, we'll be able to focus in much more with a much sort of sharper lens to look at studies where the carbon impact of illness prevention and health promotion practices are evaluated. I'm also looking at the effectiveness of green nature-based interventions where the evidence was quite limited. And then evaluating remote care, and then the effectiveness of routine monitoring and feedback on the carbon impact of greener, more sustainable and net zero approaches. And I think we're just on to the last slide now. So as I mentioned earlier, we've got a short piece of guidance, which contains the recommendations, but then there's also the evidence review and resources if you would like to read more. And there are lots of examples of good practice as well in both of those reports. And you will obviously have a chance to ask questions now, but if you want to ask further questions or your questions not answered, then please do email me. And thank you very much.
Claire, thank you so much. I think we've got a couple of questions coming in, but I think we're going to move over to Siân and Matthew first, but thank you for such a great presentation. So Siân and Matthew, lovely to see you. The floor is yours.
Thank you, Mary. So I'll just introduce myself first. I'm a service user from Luton. I've used mental health services for about 9 years. And I'm now the People Participation Lead for Sustainability at East London Foundation Trust. And I was also a member of the ERG as a patient rep with Matthew, who I'll pass on to now.
Hi everyone, I'm Matthew. I've used specialist mental health services for 24 years out of the 32 I've been here, so quite a large percentage of my life. I'm based up in Bradford, and we're very much looking at how we wanted to improve empowerment, and that's kind of why I got involved with this. And I'll pass back over to Siân to start the slide.
Perfect, thank you. So we just wanted to start with why we think this is important. So why should we care about the climate and ecological emergency? So the natural world is responsible for provisioning human well-being, from supporting food production, clean air and clean water. Basically, without healthy ecosystems, we are unable to support healthy people. I don't want to labour the point around what we get from our natural world too much, but instead kind of draw your attention to some of the ways that nature is beneficial to our mental health. So this is a review of existing literature, which found evidence for associations between nature exposure and improved mental health outcomes, which you can see there, and the references at the bottom if you're interested in reading that. Interestingly, the more biodiverse an area, the better mental health outcomes as well. Could I have the next slide, please? And what happens if we don't care about this? So we hope that you're aware of the wider implications of continued climate change, including more extreme weather events, loss of natural resources. However, we would like to bring your attention again to the direct mental health implications of climate change. So this is kind of some of the studied effects of climate change on mental health, and obviously this is a developing area. I suspect we'll probably see more and more kind of links between climate change and poor mental health. So patients with psychosis, dementia and alcohol substance misuse experience significantly higher heat-related mortality, and the use of psychotropic medication is also associated with an increased risk of heat stroke and death. We've also got links with kind of airborne pollutants associated with increased risk of dementia as well. The list goes on, and there's a couple of references there that you can read as well. Could I have the next slide, please? So climate change will affect everyone. However, it is the most vulnerable people in society who it will affect more significantly. So this means that our service users and carers will be among the first to experience the effects of climate change. And the reason we all do our jobs is to improve patient care. So if we don't already care about the environment and an ecological emergency, we should for our service users and carers. So today I wanted to focus on empowerment. And in order to act on sustainability, we must first feel empowered. And in order to see recovery for our service users, they too should feel empowered. Could I have the next slide, please? So patient empowerment is one of the overarching principles of net zero healthcare, considered to be vital to achieve greener, lower carbon and sustainable healthcare services. This is derived from the research findings of the net zero team and also the principles of greener NHS. People should feel empowered to manage their own mental health and to have control of their own care and treatment as much as possible. As a service user, I've had many interventions, including therapies, medication, but I feel that the thing that made the most difference to my recovery was to feeling empowered. We often think of empowerment purely around having personal responsibility, but we can see on the CHIME framework that there are several areas that encompass recovery that help us feel empowered. So this may be having a sense of community, having hope and something to work towards, owning your diagnosis or difficulties as part of your identity, having a sense of meaning or purpose. And finally, the last strength here is where we can feel empowered. So kind of focusing on the strengths there. For me, I felt able to meet many of these areas of recovery by being part of people participation in my trust. So for people that don't know, people participation is kind of getting service users into different things across the trust, whether that's improvement projects, sitting on interview panels, research, the list goes on. And I was initially involved in improvement projects and I felt that my opinions were valued and my experiences were understood. I also found a sense of community with like-minded people who had lived experience. And I then developed a sense of mastery, honing in on areas that I felt played to my strengths. And I found that being part of ELF's climate network gave me greater purpose and then kind of motivated me. I've recently been hired as the people participation lead for the climate network with the aim of helping other service users to join a network too. But I will talk more about this in our last webinar on the 1st of December. Could I have the next slide, please? But for me to kind of gain this sense of empowerment required my trust and the staff there to create a containing environment for me to develop. It required not just engagement, but true co-production, where I was viewed as an equal member to staff with my own expertise as somebody who has used services. And this requires system change, fundamental system change in how it perceives service users and carers in their care. So I'm going to pass now to Matthew to do the next slide.
Thank you. So part of the work around that empowering patients, empowering services and cares is around some of those system changes and allowing staff, patients and cares to work together, but also thinking differently. And there's something for every level of staff across doing this. It's your frontline staff, it's their leaders, it's senior leaders, and then it's also the board. And it's everyone's responsibility to work together to create some of that system change and allowing people to think creatively. And part of that is through these 4 different areas we've got on the screen. It's around boards and senior leaderships having trust in their frontline staff, in working together and working with system partners and patients to work together to manage a risk, to think differently, to think about how we can do things better. It's around empowering and enabling staff to do that. It's allowing different conversations to be had and feeling uncomfortable in some of those discussions, feeling vulnerable and be accepting that we may not know all the answers, because this is something what's very important now. There isn't lots of research in what we need to do. So we need to be a bit proactive. We need to work together. We need to own a risk together and work together to find a way forward. And that's the engagement, the co-design and co-production isn't just about involving patients, it's involving all different members of staff, it's involving system partners we work with, it's involving your local community into that, and not everything can be co-produced, but everyone can be engaged, and you can engage with everyone around those elements. And as much as, and it's supporting people to build up from there. People will need to engage first before they feel able to co-design and co-produce. And it's very much using a ladder we looked at earlier on how we do that. And part of that is then that system's working. It's not one trust can fix this, not one person within a trust can resolve net zero mental health and make it more sustainable. It's everyone working together in that partnership across the place-based system on how you're going to achieve this, how's your part going to work, but it's also then looking at it regionally, nationally, what impact can you have to support that wider work, what change can you do to create that, and that leads us nicely into the fourth point around leading by example. It's role modelling this behaviour. We do it with other areas of healthcare where you look to the clinicians, you look to your support workers as leading that guidance. It's very much you mirror what you see as good behaviour. Frontline staff get that from more senior leaders. They feel more approachable, therefore then build that trust. By leading by example, you're working on creating those three areas, what you need of trust, empowering and enabling by role modelling that from senior levels all the way through to frontline staff. And could we have the next slide, please? And another part of looking at it is considering how we can have sustainability in everything. Environmental sustainability equals financial sustainability. There's lots and lots of work being done around mental health transformation and NHS transformation, and it often focuses on the finances and different funding streams, and environmental sustainability comes secondary to it. And it's very much looking at part of the benefits realisation of those projects is what impact does that have on sustainability on our environment. One of the examples we've had locally is we've been looking at reducing our inpatient stays and reducing readmission from some of our reoccurring readmissions through looking at personal health budgets. And it very much had to focus on it reduces length of stay by usually 3 days. It reduces readmission by 10%, but it didn't look at what benefits, what wider benefits does it have. And part of my role within there was bringing in that, well, what is the carbon footprint of that journey in as an inpatient? What is one day's use of carbon as an inpatient? If we're doing that in the community, we're working with our system partners, so we're sharing then that we're sharing the burden in the community with our system partners. It ain't all just the NHS, it's also building better relationships for that person, and that person feels more empowered within their own care, and they're therefore looking at what else they do. It increases that it prevents isolation, which engages better within services. So that carbon, what is being produced, is much more valuable because it's being used for engaging care and promoting more active lifestyles. And it's one of them we're not saying we're going to get rid of carbon. It's how much how to reduce it and make the carbon we are using give it the best benefits. Could I have a next slide, please? And that kind of goes into the core benefits. So looking at how we bring sustainability in net zero into everything else. And by engaging with staff and empowering staff, it has that knock-on effect to the patients and carers. It allows staff to feel more involved. It allows people who have that enthusiasm to grow with it. It lets them be more curious and delve into something they've possibly not been able to do before. And by doing that, we'll create a more healthier and enthusiastic and engaged workforce. It helps reduce staff illness and it helps boost staff well-being. For patients, they also feel more motivated, they feel more engaged, they feel more listened to, and that helps reduce not just length of stays as an inpatient, but also it's had a large impact on reducing the amount of violence and aggression, the amount of restraint needed, not just in inpatient settings, but also within community settings. And it also reduces the length of time people need specialist input from community services and allows more input and opportunities to work with the wider health and social care systems. Part of doing this and working together as a system you build better relationships with your system partners, you build in a trust and a quality of services across, and you begin working on that system and partnership working. It builds better relationships, not just for staff, but also for patients. It builds more trust for both patients and carers, because it isn't just the experience of that one patient, it's everyone around them who gets affected as well. And it allows them more people to have a better trust. So it allows earlier interventions into care, and it provides more preventative opportunities. And it's around having a more positive risk management. It's everyone working together, trusting each other, sharing that risk, and everyone has, it's no longer managed just by one person. It's a shared responsibility, which also helps staff feel more empowered and engaged, and also helps their staff well-being. And I'll just come back over to Siân if she has anything she likes to add to this slide.
Thank you, Matthew. Yeah, it was just to kind of go back to kind of empowerment, that the co-benefits of sustainable mental health care. You know, we hopefully you'll be able to zoom in on this diagram either now or in the recording. But we've got kind of, you know, the financial co-benefits, like you say, the kind of sustainable co-benefits, but empowering our service users and carers reduces the need for services, builds skills, and adds meaningful activity to people's lives. But this also has the co-benefit of bringing a fresh and valuable perspective when enacting system change. You know, we need a kind of diverse opinions and diverse experiences to kind of enact the change that we're asking in terms of sustainability. I think that's the rest of our slides, isn't it, Matthew? So I think we can hand back to Mary now.
Thank you both so much. So this is the sort of exciting bit on top of this, because we've got at least, I think, 10 minutes together to go through some questions. And Siân and Matthew, there's already been a couple for you, so I hope you don't mind me sort of coming straight in with everything you said there is so inspiring. So you know, the structures that you've got in place in your organizations, making it sort of seal, actually, yes, there is a real ability to empower people in this agenda. But I know that in some organizations, it's not quite like that. They haven't got the infrastructure that you've got. They might not have the experience. So I've got a question from someone who says, I feel we could be doing a lot more in our trust to empower patients or service users and getting involved in sustainability. Where would you suggest is a good place just to start?
Would you like to answer that, Matthew? Or do you want me to?
Do you want to go first and I'll add?
Yeah. So a good place to start would be, I mean, if there's kind of no infrastructure at all, I'd start really kind of basic in terms of the kinds of services that that person's accessing at that time. It might start with something kind of like you said we did. So asking people what works well and what kind of doesn't work well, and start there. But then also kind of start to invite service users into these meetings that you're having when you're looking at kind of transformation. And a really key part of that in our trust is that service users are recognised for their input in these meetings and are paid for it. I haven't put my email here, but we can kind of share emails around as well if that's helpful. Our trust has got a very well sort of developed people participation team. So I'm sure there's kind of other people in the team who have other ideas on that as well, if we don't quite answer it fully today. Matthew?
And I guess it's kind of thinking, while you may not be able to eat yourself, within the trust there will be certain areas which very much use co-design and involvement as part of its methodology. A key area within mental health, what does this, is generally early intervention psychosis. Many EIP pathways are built around the ideas of involvement and co-producing things with service users. And I think a lot of people think it has to be something really big. It's very much starting off involving people in their own care, allowing them to build that trust, and then working up from there. And it's very much, what could you do just to let that person share their own voice or help them make an informed decision? If we start off there and work up, it shouldn't fail. And it's okay if something does fail, because it's a learning opportunity and it's a journey everyone's going through together. and it's everyone working together to look and wanting to do it for the right reasons, and everyone's coming along that journey together. So if you've got any ideas, try and find someone who supports it and go with it, because if you never try, you'll never know.
Yeah, I think that's such a helpful response, and Siân, yours was as well. And I think even, from my perspective, my takeaway from that would be, if I spent just an extra 3-4 minutes with someone, making sure that they really kind of understood the information I was giving them about a potential medication, that would be my small act of the day to contribute to sustainability, because then that person is much more likely to be engaged in it, involved in it, and thinking about, what they want their treatment to be. So I think that's such a helpful to say you can just go really small. It doesn't need to be a big infrastructure. And Siân, your offer potentially of sort of additional advice to people, I think would be hugely appreciated. I've got a question for you, Claire, that's just come in. But actually you may also want to open it up to Matthew and Siân, and this is about, is there anything in the guidance that's specifically aimed at service users, carers, advocates and activists?
Oh, that's a really good question. And I mean, the problem was that this is evidence-based guidance, and there was very, very little on patient that we could sort of condense into recommendations that were directed at patients and around patient empowerment as well. Obviously, Siân and Matthew have spoken really eloquently about that, but and we're sort of filling that gap now, I think, through the webinars and the training that we're doing. So we didn't feel that we could legitimately, based on the evidence, make specific recommendations, but it's in another iteration of this guidance and in future work that we're hoping to do at the Royal College of Psychiatrists, as highlighted in Dr. Lade-Smith's forward to the guidance. Patient empowerment is a really key area that we'd really like to focus on in the future. And hopefully, like I said, in another iteration, we will have recommendations. But Matthew and Siân, I don't know if you want to add to that.
Yeah, I was just thinking, if you're a service user in this meeting and you don't know whether there's a climate network, you don't know whether your trust is doing anything about the environment, I'd start by asking. So when I was first in the trust, it was kind of sustainability has been a big passion of mine, and I could join all these various meetings about different things, but just didn't know if there was anything going on in terms of the climate network. And I was one of the first service users in the climate network, so you've kind of got to make that jump sometimes. But I'd just say be curious and ask, and if there isn't anything going on, or there isn't anything that you can get involved in, ask why. And kind of I would definitely start there.
Thank you, Siân. And now this is a sort of, I think this is for everyone. This one, it's a lovely summary. So I'd love to hear of any ideas and initiatives that other areas might have adopted in promoting the green and sustainability programme of work within inpatient and community mental health services, and also the resources needed for things like this. I guess I'm thinking of ideas like outdoor walking and groups, any green activity, sustainable arts and crafts involving nature, and so on. So within our trust, we're starting to put a directory together of activity ideas and teams that service users can pick up and access also. So have you got any suggestions or signposting around this work? So perhaps, where to get resources or what this person might like to add into their directory.
I have a couple of ideas. So firstly, don't be afraid of outside kind of, using outside services. So in many sort of and many of the kind of sustainability charities or wildlife charities do have kind of people participation elements of that. You can look at how you can, I'd say, reach out to them, see if you can get them kind of involved in any sort of conservation work or anything that's happening in the local community. And then one kind of resource I use quite a lot is just the Wildlife Trust website has a list of loads of different art and craft things you can do. So if you can't be creative, there's all kinds of things on there, whether that's rewilding in your garden to sort of arts and crafts. And I'd say kind of just think outside the box. start there. I don't know if anyone else has any other suggestions.
I think there's something around looking at how you work with some of your other colleagues and services as well. There'll be many areas where they'll use their social prescribers within primary care. They'll be able to signpost very appropriately to some of these services, and it's building those relationships, and it's acknowledging that things will change. So having a directory is really good. It's just very time consuming keeping it up to date, and it's make sure you're not trying to do that as an individual, and it's much more as a team or a service or a system what's owning that piece of work, and it's looking at who else can you involve. The more people you can get involved, the more likely it is to succeed. And it's looking at what are the alternate. Not every service will think of it as a green initiative or a green therapy, and it's looking at how do you support those services and those teams in understanding that what they currently offer is a green service, or there's something what they could just tweak slightly to make it more green. And another part would be asking what the people in that community want. But some of our services cover a very large geographical area, and the needs and wants of those people will be very different. So it's very much ensuring you listen to your staff, listen to your colleagues, but how are we getting that patient voice in there? Have we asked them what it is they want and not just what staff are assuming? And it's then working with your own trust and seeing, could they work with someone else to create more green areas? Could you use one of your car park spaces to build a small allotment? There's lots of different ways of doing it, and it just takes a bit more of an initiative and creative thinking.
Thank you, Matthew. And that question gives me a nice opportunity to plug our Knowledge Hub, of which the link will be in the chat. But the intention behind this is on the screen. It's to build a community of practice around this for people who exactly this. They're looking for ideas, they're looking for inspiration, they're looking for a better idea on how to, measure what the impact of things are, or just get inspired or feel supported, because sometimes it can feel a little bit lonely in this space, and know that there's a huge community of people out there. So the Knowledge Hub is going to be the place where resources, evidence, the report, information about events and so on will provide a bit of a home for people interested in this agenda and trying to take on implementation of the recommendations. So I think, and you've also had the person who asked that question says thank you to the three of you.
Mary, could I just plug the guidance and evidence review as well, because there's some really lovely examples in there. Can I just very quickly give one from Greater Manchester, who work with, they're called Sow the City, that's SOW, to develop a green walk at Prestwich Hospital that incorporated things, like orchard and wildflower areas. And Sean mentioned, going to the local wildlife trust, and they've also connected with Lancashire Wildlife Trust, My Place programme. So that's like a green wellbeing service which supports people to connect with nature. It can be anything, doing anything from kind of bushcraft through to carpentry or survey skills and nature walks, that kind of thing. But that's just one example. There are lots more. Thank you.
Yes, and you absolutely must plug the report, the supporting document. I think, Claire, you'll correct me, but I think it's over 140 pages, and it is just packed with evidence, examples, great practice from elsewhere. And so please do look at the two bits of the report. The first one is the recommendations, it's slightly shorter, and the second one gives you all of that background work. So I think we've got time to sneak in probably just one final question, and this is interesting. So this is a question regarding the recommendations or potentially future areas of research. I was quite surprised to see that given the scope of the report, there wasn't a specific area of focus on the impact of eco-distress and eco-anxiety on healthcare staff or service users or in the wider population. Perhaps this is because the report is leaning towards the mitigation of climate change rather than adaptation, but I think it'd be huge value and more guidance, research support, healthcare through these sorts of emerging challenges ahead. So just whether any of you had any reflections on that, as it's sort of what you found when you were looking at this work, or just any thoughts about it more widely.
I can just quickly come in there. So yes, absolutely. I mean, I think the person who asked the question kind of partly answered it themselves. It was it was really just not in scope for this project, unfortunately, although we kept sort of circling back to it, and we've, as Mary did at the start of the session, and as Siân did as well, highlighting, the obviously the mental health impacts of climate change are huge, and the Royal College of Psychiatrists has done a lot of work around this as well, has a lot of resources available on the website, so maybe we can make those available I'm sure we'll make those available in the Knowledge Hub. But yes, the focus was on, as the questioner said, on mitigating the effects of climate change on mental health care, and doing all that we can to make mental health care net zero. But yeah, obviously recognise the importance of addressing eco anxiety.
Thank you, Claire. Siân, Matthew, anything you wanted to add?
Yeah, I was just going to say it's quite a growing field, isn't it, around sort of eco anxiety and eco distress, but and it's something I've definitely experienced myself. But I'd kind of, if you are supporting either a service user, carer, or staff with that is experiencing this distress, I'd treat it the same as you would treat any kind of anxiety, in that in order to kind of combat anxiety, we know that we have to act opposite. So if we create opportunities that people can do sustainable things, do things that kind of help us achieve net zero goals, so whether that's inviting service users into your climate network or starting a project with them, and equally if it's a staff member to kind of support staff and kind of find a group of staff who might experience these difficult emotions, but to act on them and find that kind of sense of community will combat some of that distress and give kind of meaning to the feeling behind it. I hope that makes sense.
That makes perfect sense, Siân, and you brought us almost perfectly up to 2 o'clock. So I think all is left from me is to just say a huge thank you to everybody that joined, but also an enormous thank you to our speakers. Siân and Matthew, you've just been incredible throughout all of this work, what you've contributed the last year. And it was inspiring to hear you talk about how to make sure that this isn't job of the healthcare professionals, this is part of the whole mental health community, which is fundamentally about empowering the people that these services are for. So thank you both. Siân, I know that there's opportunity for the audience to see more of you because you're top and tailing our series. But we've also got, I think it's 2 days' time, our next webinar where we're going to be looking at nature-based interventions. You've got the QR code for the Knowledge Hub. You've got access to the report, the recommendations, and all the resources there. We as the Royal College of Psychiatrists hope this is a continued conversation, that more activity will be happening in this area. But in the meantime, thank you all for your attention. Hope you do read the report. I hope you take one thing and commit to one action from it, because time is limited in order for us to make the impact that we want and to change the way that we deliver mental health services. So thank you to you all. Have an excellent afternoon, and thank you so much to our speakers for joining.
Thanks, everyone.